I am a molecular biologist and immunologist. My training has been in chemistry, which is a BS degree, a master degree in education, a master degree in biochemistry, and my PhD was on molecular biology, protein chemistry from the University of Pennsylvania in 1980. So sometimes I said I was 2 years old when I got my PhD. The number of years count. At the University of Pennsylvania, I was in charge of a number of colleagues, junior colleagues, because I had a wonderful, more wonderful, I can say, supervisor who recognized that I was hooked to science. And he allowed me to be a junior faculty, but I was acting as a senior faculty. I had the responsibility of 11 people as a junior faculty, assistant professor. In the University of Pennsylvania, one of my major projects was on acute and chronic inflammatory diseases in the eye. So we were working on it, and we saw the acute inflammation, and then the clinical aspect went away, and then we saw tumor development, because I was very curious that what we were putting in the eye should have gone somewhere, not to become clinically non-active. So we saw the tumor, and I had no idea how important and how significant this work was until I came to the National Cancer Institute, NCI, National Institute of Health. I started reading cancer-related topics, and I noted that our finding was first and the only systematic analysis of inflammation-induced tumorogenesis and angiogenesis. They were asking me my assignment was to develop some concept and write about for early detection. So I wrote several concepts, and the management, I think, I'm not in their head, they thought that I'm going to take over the institute because of what I was proposing. So they said inflammation has nothing to do with cancer. And I was forced to resign. And I took legal action. Fortunately for me, I found a wonderful human being as my attorney, who took on the challenge. It's not easy. It's not easy even for the attorneys. So he took on the challenge, and I won, not once, not twice, multiple times against NIH, members of NIH, that, the retaliation, of course, goes on and gets stronger. And because of one of my comments that I gave in one of the meetings, that I said what they were proposing is scientific or medical Ponzi scheme, because the management provided $60 million as a bribe. I hope somebody would investigate on this. $60 million for somebody to become my so-called supervisor on a 5 years conspiracy against me, giving more than 25 staff, salaried staff, to get rid of me. So I settled. They had to settle with me because I had a lot of pending cases, and they settled with me, and I retired as professor from the National Cancer Institute. The retaliation continues. I published in 2005 in Federal Register on standardizing cancer biomarker criteria as a foundation for a digitalized cancer biomarker for oncology research. Progression and continuation of this also was prohibited, but I want to say a few words that change is coming. I'm very, very hopeful for the Secretary Kennedy, that I admire for his taking a standing and for his work and books. I'm sure all of you know about the real Anthony Fauci, Bill Gates, and Big Pharma. I encourage you to read it. I bought the book and gave a few copies to my colleagues. Of course, not everybody is happy that he's taking charge of the public health, and he's trying to see what the true science means, and I'm all for the true science. And before I finish, let me read one of the slides that I have. Financial analysis of healthcare, the Sacker block, if you know it. It says the entire medical system, including the insurance industry. I'm dealing with a colleague who has some issues with the insurance industry from California. The medical system has been ultimately controlled by one giant oligarch. Its annual value was 3.7 trillion, amounting to 15.9% of GDP in 2018. That is nearly double the average of developed Western country, but we are not the healthiest nation in older or younger generation. Brandon Turbeville also reported that corporate lobbying group, which is called ALEC, or American Legislative Lobbying Group, are behind the mandatory vaccine agenda. And this was published by Edward Griffin, you need to know, in 2020. Past the rest of it, but one thing needs to be known. Some of you may know that 8 decades ago, NIH, which I wrote, is the hidden crown jewel of government corruption. I hope I don't continue saying that. I have a lot of hope. Established and received taxpayers' funds in collaboration with other government agency and center within the health HHS, Health and Human Services. They had the mission to improve public health and prevent and treat diseases, save lives. With regard to cancer, I want to quote from Sohrab Sepehri, a poet, who says, "We have remained in the dark long enough to talk about light." And that is my hope for the Secretary Kennedy to do something, and he is doing something in this atmosphere of all those who are against him. And better hygiene, use of antibiotics, and modern technology improve health and life expectancy. However, American baby boomer and offspring are not healthier generation. I have written about it in detail in my books, Inflammation, Aging, and Cancer. Not promoting this, but I I want to show that I know a little bit about what I'm talking about. American baby boomers are not healthier generation. The question I have posed is, does the public health conflict with power and profit of medical establishment or the organized medicine? Another issue is that it should be important to you all. It should be that the 5 leading causes of death in 1910, a century ago, was pneumonia and influenza, tuberculosis, diarrhea, heart disease, and stroke. Cancer was not even in the radar screen. But in 2013, the American Association for Cancer Research, which in the annual meeting said that 30% of women and 50% of men develop cancer. Why? Is it because in 1955s we gave the public a virus-contaminated polio vaccines? The rate of cancer shoot up, and we are seeing more and more cancer, and chemotherapy is not the answer, as we have seen. We have spent $30 to $50 trillion of taxpayers and private organizations in doing something about cancer. But the war on cancer, like any other war, the first casualty is the truth. Thank you very much.